Good morning. Let me first acknowledge the Yagara and Turrbal people, the traditional owners of the land in which you're meeting today. And can I acknowledge any other Aboriginal traditional owners who may be present in the room. Thank you for inviting me to speak to you today. I apologise for being unable to be there with you at this IAHA First National Conference. But I would like to start with my sincere congratulations to your Chair, Faye McMillan, to your board members, and of course to Craig Dukes, CEO, and his staff on this very, very significant occasion. The first Indigenous Allied Health Australian National Conference. You know, as we all do, your members working throughout Australia are a central part of the primary healthcare system. I'm pleased to note that the theme for this, the first IAHA National Conference, is to join the dots, an interprofessional approach to Indigenous health. It's good to know that the conference will focus on creating and building professional working relationships and partnerships, building teams. These are, as you know, fundamental to ensuring effective healthcare. I would like delegates to take this opportunity to connect and share your knowledge on best practice in allied healthcare for Aboriginal and Torres Strait Islander peoples, wherever they might be. I very much look forward to hearing the outcomes of your discussions. As you know, the Australian Government remains committed to closing the gap in life expectancy between Aboriginal and Torres Strait Islander peoples and the wider Australian population within a generation. This is a challenge, but the key to closing the gap is boosting the Aboriginal and Torres Strait Islander workforce. I firmly believe this. Organisations such as Indigenous Allied Health Australia are essential to providing support and encouragement to students and the workforce. We still see challenging issues in Aboriginal and Torres Strait Islander health. Facts that you only know too well. As you know, to close the gap we need a culturally appropriate workforce. One which is ready and able to engage with patients, to allow them to feel culturally secure. As you're all aware, allied health professionals play a very vital role in working with others in the primary healthcare team to coordinate and deliver this kind of care. I'm pleased to say that the Australian Government will continue to work closely with peak organisations such as Indigenous Allied Health Australia to improve access to healthcare and enable the Australian healthcare system to respond better to the needs of Aboriginal and Torres Strait Islander peoples. National Aboriginal and Torres Strait Islander Health Plan is an important component of what we're doing now. This plan, very important for all of us, will guide all Australian governments during the next decade and beyond, in my view, in making policy and designing programs to improve the health of Aboriginal and Torres Strait Islander people, to give us the best chance possible of closing the gap. As health professionals, I encourage you all to consider a number of questions as part of this conference, and where you can to engage in the process of consultation around the health plan. Firstly, how could the health system work better for Aboriginal and Torres Strait Islander peoples wherever they might be? Secondly, what more could be done to enable Aboriginal and Torres Strait Islander health professionals to be recruited to the health workforce? How can we attract people in and build the competency of them to make them part of a professional workforce and to be supported and retained, no matter what role they might fulfil? And thirdly, how can services become more culturally competent and appropriate for the needs of Aboriginal and Torres Strait Islander peoples, regardless of where they live? I encourage you all to get involved in consultations which are already engaging with young Aboriginal and Torres Strait Islander people who have done that already, local health providers and state and territory governments. I know I've seen Craig at a number of these consultations. If you can't make it to a consultation session in person, then I encourage you to make a contribution online via the website. Have your say so that you can help shape the types of health services and how they will be delivered into the future. Indigenous Allied Health Australia has made and continues to make options for encouraging more Aboriginal and Torres Strait Islander people to take up careers as allied health professionals. IAHA is contributing to improving the knowledge and competencies of allied health practitioners, working with Aboriginal and Torres Strait Islander peoples across the country, and indeed with their communities. I'm sure the delegates have much to discuss over the next 2 days about the challenges and indeed the opportunities ahead for an innovative, connected, allied health Indigenous workforce. Best wishes, and while I'm unable to be there with you, I'm certainly there in spirit, and I'm very honoured to now officially declare your conference open. All the best for your discussions. Thank you.